Greetings. Did you know that Medicare reported in 2014 that at least 70% of people who reach age 65 will need long-term care at some point in the future? Current expenses at a facility range from $45,000 to $90,000 a year. Now, obviously, the best way to cover these expenses is to purchase a traditional long-term care insurance policy. However, for most people, traditional long-term care insurance is too expensive, too hard to get approved for, and frankly, no one wants to spend years of their life in a facility. You see, 7 out of 10 will need care, but hardly anyone can get traditional long-term care insurance. That's why retirees are flocking to a new type of policy, a home health care policy, designed for those who would prefer to receive care in-home. It is easy to medically qualify for, it's comprehensive, and unlike traditional long-term care insurance, you can actually afford it. Sure, it's a step down from traditional long-term care insurance, but for those who don't have long-term care insurance in place, a home health care policy is a massive step in the right direction. Hi, my name is Joshua Music, and in this video, I want to explain to you and tell you about a brand new type of policy that has recently hit our market. You see, we've had lots and lots of people over the years come to us and say, hey, I want to cover long-term care expenses. And so we make application, and usually about 6 weeks later, they get declined. But if some get through, we tell them the premium that they're going to have to pay. And at that point, they're like, no, I can't spend $250 a month on long-term care insurance. So most people just don't end up taking it. So because of this, we try to look around and say, hey, what is available out there that people could actually afford, that they can actually get approved for and do want? The picture on your screen here shows a house fire, a massive house fire. The graph on the left, there are 1,200 little squares in that graph. There's one red dot in the center, and that represents the likelihood that your house will ever have a massive fire. And yet, all of us have carried homeowners insurance for as long as we've ever owned our house, a 1 in 1,200 chance. This next graph shows the chance or the likelihood that someone will need long-term care at some point in the future. 840 in 1,200 chance. That's about a 70 or 68% chance. On your screen here, I'm showing you how much it costs to be in an assisted living facility or nursing home care. You'll see the assisted living, the national monthly rate is $3,628. Nursing home care is $225 a day or $253 a day. Now let me do the math here real quick. $250 a day times 30 days, you're looking at $7,500 a day to be put into one of these facilities, and nobody even wants to be in them, right? If we look here, I zoomed in on Kansas City. This shows the actual for our region. If you look over here on the right, I have it circled. A private room's $213 a day. Multiply that by 30, that's $6,390. Assisted living facilities about $100 a day. That's $3,000. Okay, so good news is we're a little bit less than the national average, but hey, this is still very, very expensive care. I think another thing that people say is, hey, my kids will take care of me if I have a problem. Well, there's a few things that you need to know about that, because that puts a lot of stress on your kids, your family, puts stress on your grandkids, because now all of a sudden the kids aren't at home to be with the grandkids. They're not able to take them, to soccer practice or whatever it is. If you look here, 7 hours, almost 18% of a 40-hour work week are going to be lost. So your children's income is going to be going down if you're banking on the fact of them being their caregiver, right? So it says, what does it say? 33% average income is lost by caregivers each year. Impact on caregivers' health and well-being. 54% of caregivers experience negative feelings as a result of caregiving, including guilt and resentment. I don't know about you, but I don't think I would want my children to have to face these sort of things all because I didn't prepare for my future. Okay, 43% said long-term care event negatively affected their personal health and well-being. So if you want to let your children bear the brunt of this, hey, that's your doing. But I think it's very important that you realize that there will be impacts on them, both financially and just physically and mentally and with the family and the grandkids. So to solve this problem, there is traditional long-term care insurance. Transamerica, Genworth, MassMutual, Mutual of Omaha, right? All these companies offer traditional long-term care insurance. It works basically by you paying monthly premiums and gives you access to a bucket of money to use for nursing home, assisted living, sometimes if you set the policy up right, home health care. Usually that bucket of money is about $100,000, maybe a little bit more. And hey, this traditional long-term care insurance is great, right? It's the best way to cover long-term care expenses. But the problem is almost no one can get approved for it. And if they can get approved for it, the premiums are too high for people to be able to keep the policies. So what we see a lot of people do is they get the policy, they pay on it for 5 or 10 years. Then when they, just simply can't afford it, they drop it, and all that money was wasted. So in the end, hardly anyone is prepared at all. So I want to explain to you today a little bit about a new type of policy. It's called home health care insurance. It's offered through Kemper Senior Solutions. Kemper is a big company. This is a picture of one of their buildings in Chicago, actually. They were founded in 1956. They're rated A. They're headquartered down in Oklahoma City. They have 6 million policyholders, 7,000 employees, $8 billion in assets. They're traded publicly, so it's a big insurance company, right? And they're the ones who offer these home health care policies. Now, before we jump into how this policy works, my attorneys tell me that I have to put this in here, just saying basically that the details and the things that I say in this presentation aren't legally binding. Yes, we've studied these policies for a couple years. We know how they work, but at the end of the day, it is what is in your policy contract that determines the benefits that you get. Okay. So first off, the home health care policy that we're going to be talking about will reimburse you up to $150 a day for home health care services, okay? It does not cover nursing homes. You have this policy, you go into a nursing home, it's not going to pay anything, okay? It's going to pay for services and care that you receive in your home, okay? Now, that makes sense for most people. Most people want to stay in their home anyway, okay? So here's the schedule of payments, okay? This is how they reimburse. So if you have a skilled nursing care person, like a registered nurse, an RN, they're going to reimburse that person $75 a day. So if you have a nurse come by, for a couple hours to take care of you, they're going to reimburse $75 a day. General nursing care, $60 a day. Physical therapy, $75 a day. This is so you don't have to be in a care facility to receive these types of services. They'll reimburse you $75 a day to have somebody come by your home for an hour or two to take care of you. Speech pathology, $75. Occupational therapy, $75. Chemotherapy, $60 a day. And you can kind of see how this list goes. Okay, they're going to reimburse you. They combine the services that you receive for that day, and they will reimburse you up to $150 a day for the services that you receive. Okay, so $150 a day is $4,500 a month. Okay, so by purchasing this policy, you've given yourself access to $4,500 a month or $54,000 a year for home health care. Okay, how long does the coverage last? Great question. Like I said, the best way to cover long-term care expenses is through traditional long-term care insurance. But in the event you don't want to afford that, can't afford it, can't get approved for it, have been declined like most people, this coverage will last for 1 year. So this is a 1-year benefit. However, it has an unlimited number of restoration periods, okay? So what happens is if you have 6 months that you do not need services, in other words, a doctor said, hey, they don't need services, they're fine. After 6 months, the policy will reset itself, okay? Then you'll have that 1-year benefit available to you again down the road, okay? And there's an unlimited number of times that 6 months can restore, okay? Medical underwriting, who can get this policy? Because like I said, one of the major problems with long-term care insurance is getting approved. You've got to be able to answer no to both of these questions. Number one, are you currently living in a nursing home or assisted living facility or currently receiving home health care or similar type benefit? Hey, if you've already got a nurse coming into your home or you've already got some sort of therapy coming into your home on a daily basis, you're not going to be able to get this policy. Secondly, are you physically unable to perform routine activities such as bathing, dressing, eating, toileting, or transferring to or from a bed or a chair? If you're having a problem with that, you physically can't do that, you're not going to be able to apply for this coverage. That's why you have to get the coverage now. You can't wait down the road and say, hey, I'll apply for this in a few years. Well, something happens, I'm sorry, and now you need help. You're not going to be able to get that, okay? It's kind of like your house burning down and you are calling to get homeowners insurance. Well, it's too late at that point. Like all insurance, you have to buy it before you need it. That way it's available for you when you do need it. And guys, long-term care, Medicare says 70% of you, 7 out of 10 of you, will need some sort of long-term care in the future. So it's best to prepare for this ahead of time. Okay, what's your investment? Okay, first off, home health care policy will reimburse you, again, $150 a day, so that your family members don't have to suffer. You don't become a ward of the state, where the state is dictating where you get your care, what kind of care you get, and who you're getting that from. And this policy will allow you to stay in your home to receive care. So here's the monthly premiums. Okay, you're going to see this is really affordable. Kansas, if you're between the age of 61 to 64, the premium's $35.45. Missouri's $21.45. That's dirt cheap, guys. Okay. Kansas 65 to 70, $36 a month. Okay, this is a rate lock for 5 years. Okay, it jumps up every 5 years based upon your age. So whenever you hit 71, then you see it's going to jump up a little bit. Okay, Missouri 71 jumps up to 28.85. Okay, so these rates are banded. Okay, if you're 65, you're going to be locked in for the next 5 years. Okay, then it'll bump up. Make sense? Now, I'm going to show you a little trick that most people don't know about, and honestly, most people don't use, but it's something that you should use. I'm going to show you how you can even lower those premiums, and those premiums are low, right? But I'm going to show you how you can cut that down. Kemper has a prescription drug reimbursement program, okay? And the way it works is they will reimburse you for medications that you've received just from your local pharmacy, $250 a year, okay? So medications that you've purchased, you can send them the receipts, and up to $250 a year, they will reimburse you. They'll actually write you a check for the difference for that amount that you spend. $300 a year in Missouri. Okay, so how does it work? Well, Kemper's, like I said, going to reimburse you $250 in Kansas, $300 in Missouri. The reimbursement is based off the full retail cost of your medication. So if you had a retail cost of your medication that was $170, but you only paid a $35 copay, a lot of you have medications like that. They will reimburse you based upon that full cost of the medication, okay, not the copay. So there's a $50 deductible, then Kemper reimburses 80% of the remaining cost up to the maximum, okay? So kind of the point is Missouri residents can get this policy for essentially free, okay? Kansas residents will pay maybe a net $15 a month, and I'll show you how that works. So here's how it works. Total, let's say you're somebody and your total prescription retail cost was $500 for the year. Okay, that's not very much. Remember, this is not what you paid in copays. This is the actual retail cost of those medications. Okay, this has nothing to do with insurance. So retail cost for the year is $500. Well, you're going to subtract $50 because they have a deductible, right? So $500 minus $50 is $450. You multiply that total by 80%, so $450 times 80% is $360, and Kemper will send you a check for $300. If you're in Missouri, $250 in Kansas, okay? So that's why I say, hey, you can cut your premium costs in half because it just works. Now, it's actually very easy to do this. Now, here's the thing. Kemper doesn't make this hard for you to get that reimbursement money, but they definitely don't advertise every year, hey, you need to send us your receipt so we can send you a check, right? They're not going to do that, but it is built into the contract and they have to do it, okay? Number one, you go to your pharmacy and you say, hey, I need a list of all the medications I've been taking along with the retail cost. Show me what my costs have been, okay? You're going to fill out this request form. I have it pictured on the right here. Now, what you need to know is this is a request form that I made. This isn't something that Kemper made, right? They're not too big in wanting you to actually use this RX reimbursement. They would prefer you buy the policy and then forget about it. But I've made this request form, and as long as you use this every 12 months, you'll get your money. Okay, so you're going to mail the receipts that you got from your pharmacy and this request form to Kemper, and Kemper will actually mail you a check. Okay, $250 in Kansas, $300 in Missouri. On the screen, I'm showing you the black numbers of the monthly premium, just like I showed you before. $35.45 for 61, $36.05, right? But net, if you use the full reimbursement for the year, and then I divided that by 12, this shows you essentially what you'll be paying, okay? 61 to 64 in Kansas, you're going to pay net under $15 a month. 65 to 70, $15 a month, okay? If you're over in Missouri, you're actually getting paid to have this policy. Look at that. You're getting paid to have this policy. You're going to make net $350 a month. In Missouri, it makes no sense not to get this policy, Okay? Now, Kemper's banking on the fact you're not actually going to remember this, but you will. If you're my client, you're going to remember it. And you'll get this policy for literally next to nothing. Now, here's another way to view it. I've broken this into annual premium. So, 65-year-old in Kansas is going to pay $433, but after you've subtracted $250, you're going to pay net $183. Okay, Missouri, you're actually going to make $40 a year. Okay, now for some of you, you're not going to have medications. You're not taking anything. Well, in that case, you got an amazing policy for $260 a year, right? Not much at all. What are you getting for that money? Well, you're getting $150 a day for home health care. You're getting $4,500 a month or $54,000 a year. This is huge, okay? And you're not having to hardly spend anything, okay? Now it's for home health care. Remember that. It's not for assisted living. It's not to pay for a facility. It's to reimburse you for expenses used at home, okay? Now there's another little tip that most people don't know about, and that is you can buy 2 of these policies to protect against inflation, okay? This is a screen from earlier, but I've blown it up. The annual growth for assisted living has gone up 2%. Nursing home care is going up 3% a year. Home health care is going up, right? These costs are going up. So if you're not going to be using this policy for a while, you bet that $150 may not be enough down the road. So if you get 2 policies, instead of getting $150 a day, you're going to have $300 a day for home health care. And you can go ahead and double the RX reimbursement amount. So Kansas, you're going to get $500 a year back. Missouri, you're going to get $600 a year back. Okay? So you're going to get double the coverage and you get double the reimbursement. Now, some of you will say, hey, so, this benefit lasts for a year. Well, if I get 2 policies, then I can make it last for 2 years. It doesn't work that way, okay? You get up to $300 a day. It's not $150 a day for one policy for a year, and then the second year you get another policy. The second policy kicks in. No, it's the benefit lasts for a year, and then it restores itself in 6 months, and then you can start doing it again as long as the doctor says, hey, they don't need services, okay? So this screen's showing basically what your reimbursement amount would be. Skilled nursing care, if you get 2 policies, now all of a sudden you have $150 a day for skilled nursing care by an RN. Okay, you can go down that. This really increases a lot. I'll let you look at that for just a moment. Okay, so this is a monthly premium for 2 policies on here. So if you are a 65-year-old in the state of Kansas, the premium is $72.10 a month. However, if you use that full reimbursement program for the RXs, you'll be net spending $30.46 a month. Hey, that's dirt cheap. Okay, Missouri, you're actually going to make $6.70 a month if you're a 65-year-old in the state of Missouri. Okay, so how do you pay for it? It's a good question. Keep its prices low. Kemper only accepts automatic monthly bank draft. Okay, so if you decide, hey, I want to try to apply for this, this is how you pay for it. They're going to ask for automatic monthly bank draft. If you want to apply, there's 3 ways you can do it. I have set up an enrollment link on my website, enlightenu.com/HHC for home health care. You can go right there. Also, I sent you the enrollment link in the email that you received this video in. Okay, so you can go and enroll right through that link. Okay, it will get sent to our new business department. Our new business department will submit the application and go from there. Number 3, paper enrollment. If you're just more comfortable, hey, I'd rather just print out a paper application and apply, I've attached that to this email. You can fill that out, print it out, fill it out, and mail it in. Okay, on the paper application, there's an address for where you can mail that to. It's just to our new business team here at Enlighten You. So if you enroll, your policy's effective date will be on the 1st of the following month. So let's say it's October 15th. Well, we're going to start you November the 1st, right? If it's if the date that you apply is November the 2nd, your policy will go into effect December the 1st. Okay? And you'll receive your policy in about 2 or 3 weeks after applying. So I just want to review. You get 1 policy, you've got up to $150 a day, $4,500 a month, $54 a year. If you get 2 policies, that's $300 a day for home health care, $9,000 a month for home health care, or $108,000 a year for home health care, right? And the reason you're doing this is not for you guys. It's for your spouse. It's for your potential caregivers. It's for your children. It's for your grandchildren. Because 7 out of 10 will need some sort of care. And if long-term care insurance isn't in the cards for you because you're not healthy enough, because it's too expensive, you can't afford it, you don't want to afford it, then this is a good substitute for that. Okay, here's the monthly premiums again. This is for one policy. You can apply using the paper application or online. I'm going to leave this screen up here for just a minute. Take a look, think about it. If you have any questions, I want you to just reply to that email or give us a call. Our phone number is 816-309-4300. We would love to answer any questions and help you get enrolled and find out if this is right for you. Thanks so much for watching this video. I hope you have a nice day.